How to score tooth wear, a BWE guide for dental students. BWE stands for Basic Erosive Wear Examination. To score tooth wear, examine the 6 sextants in a clockwise motion. In each sextant, record the worst affected tooth with the highest score. Here's what each score means. Score 0 means there is no erosive tooth wear. Score 1 looks frosty or dull, which indicates an initial surface texture loss. If there is cupping, it will have a diameter of 0.5 mm or less. Score 2 shows less than 50% of hard tissue surface loss. You may see some dentine. The diameter of cupping would be 0.5 mm or more. Score 3 means severe tooth wear. More than 50% of the surface is lost, and dentine is usually exposed. Concavities may merge together, and in some cases, there's total or partial loss of the occlusal surface. On restored teeth, look for wear around the restoration edges. Include that area in the total affected surface. The BWE uses a cumulative score taken from all sextants in the mouth. If the cumulative BWE score is 2 or less, the patient is at no significant risk. Management here is simple: routine maintenance and observation, with reassessment roughly every 3 years. For scores between 3 and 8, the patient is considered low risk. In these cases, assess their oral hygiene and diet, provide tailored advice, and maintain routine care. Re-examine every 2 years to monitor any changes. Medium risk is defined by a cumulative score of 9 to 13. Here, it's important to identify and address the main causes of wear. Provide oral hygiene and dietary advice, consider fluoride or other protective measures to strengthen the tooth surfaces, and ideally avoid early restorations. Instead, monitor progression using study casts, photographs, or silicone impressions. These patients should be reviewed every 6 to 12 months. Finally, a total score of 14 or more indicates high risk. The approach is similar to medium risk. Identify causes, provide advice, and strengthen the teeth with fluoride or other strategies. Progress should be closely monitored with casts or photos. If the wear is severe or progressing quickly, special care including restorative treatment may be required. Reviews should also be scheduled every 6 to 12 months.